Welcome, and thank you for applying to our UC Irvine Glaucoma Fellowship Program. I congratulate you on a superb career choice. This is a great time to be entering the field of glaucoma. I'm just going to go through and give you a brief overview of what our program has to offer. Again, like I mentioned, this is a great time to enter glaucoma. There's a lot of new surgical innovations. It's an exciting time to be learning all these great new things. And there's a growing need for glaucoma specialists nationally as our population grows and ages. So what's special about our glaucoma service? Well, I think it's a great place to be because this is a nurturing environment with really superb history of mentorship. Part of our glaucoma service includes Dr. Ken Lin, who is a fantastic clinician and clinician researcher. He has an MD and a PhD and is involved in some fascinating research that's very productive and very cutting edge. I have been fellowship director of this program for the last 16 years, and I'm very proud to say that we have had a fellow every single year, and they're all very successful, and I consider all of them my close friends. During the fellowship, you'll be training mainly at three sites. The Gavin Herbert Eye Institute, which is on the campus of UC Irvine, which is our main private facility. We also have training at the hospital campus up in Orange, which is about a 20-minute north drive from the facility in Irvine. And that's where you'll be having your academic clinics, as well as learning at the Long Beach VA. And that's where the majority of the surgical training is done and where the glaucoma fellows really act as teachers for the residents and supervise resident clinics and surgeries as well. Each of those sites has clinical and surgical facilities. Our facility at the Eye Institute, which is on the campus of UC Irvine in Irvine, is a very new facility. It's state-of-the-art. We just moved into it about 7 years ago, and it was really the culmination of years of planning and generous private donations. It has 4 levels. The ground level has the ambulatory surgery center, which is fully equipped with all of the gadgets and gizmos that anyone could hope to have. We have the Callisto, we have the Aura intraoperative aberrometer, we have the Catalyst femtosecond laser, we have all of the MIGs that are on the market, including the trabectome and all of the implantable devices. We do have a micropulse laser. We have surgical video recording. It's really a state-of-the-art facility with 2 operating rooms that function simultaneously. The first floor is the clinical space. We have numerous lanes, and most lanes are dedicated to specific services. So we have our own glaucoma lane, a retina lane, and so on. Again, in that area, we have every piece of equipment you could hope to have, including a UBM, a Heidelberg Spectralis, the Zeiss SD-OCT. We have OCT angiography, all of the lasers you can imagine. There's a minor procedure suite as well, and we even have a Starbucks in our waiting room. The second floor is shell space, so currently it's empty. And the third floor has all of our administrative offices. That's where we have our wet labs for our residents and fellows, and most of our conference rooms. So considering where you want to train, it's a big decision. It's really going to lay out the path for your future. And some of the things that I think are really important to consider when choosing a specific location is, number one, who are your mentors going to be? Are they going to be people with whom you're going to feel comfortable learning? Because I truly believe that when you are in a nurturing environment, you learn not only actively but passively as well. You're in an environment where learning is easy, as opposed to when you're in duress and very stressed out. Learning is it's more challenging. It's just a fact. Also, you want to go somewhere where there's a wide range of surgical experience and variety. You want to go somewhere where they do pretty much everything that there is, so that you will learn how to do all of those things and then choose what works best in your hands. So make sure you choose a place that doesn't only do one type of approach. So there should be a range of conservative and aggressive approaches. How many fellows are in that program? Is your training going to be diluted by having a number of fellows there? In our program, there's only one fellow every year, as has been since I took over as director of the fellowship 17 years ago. And we've had one fellow every single year, and that fellow gets all of our attention and is really our priority. Operating room supervision. A fellowship is just that. It's a year of training. That's when we don't expect you to really know anything, and we supervise every single case. Either myself, Dr. Lynn, or whomever is at the VA will be in surgery with you for every single case until you truly feel comfortable to have us kind of sit back a little bit. And that doesn't usually happen until after mid-year, and even then, we're in the room with you on every single case. And so that way, we don't expect you to make decisions on the fly, and you can really learn from our experience. Also, you should train somewhere where you are given an opportunity to wear a lot of different hats and experience a variety of roles. At UCI, you will be serving as teacher to the residents in the academic clinic, even though one of us as faculty will always be there as well with you. But it really gives you a chance to learn from teaching. So it's important to go to an institution where you get to be the student and the teacher as well. In our fellowship, we have a balanced clinical and surgical experience with a variety of exposures. Because of our different locations, we have different patient populations that have quite a different kind of display of pathology. And so up in our clinical practice up in Orange, we have a lot of angle closure patients from neovascular glaucoma, a lot of Asian patients with acute angle closure, and of course chronic angle closure as well. And so that gives us a really depth of pathology. In Irvine, you'll see a lot of patients with primary open angle glaucoma, pseudoexfoliation, and pigmentary glaucoma. And so that's also really adds to the breadth of fellowship. We also see quite a few pediatric glaucoma cases, especially with our collaboration with the Sturge-Weber Institute, which is at the Beckman Laser Institute. We have a lot of patients who are being treated for their Sturge-Weber with the laser, and we provide all of their glaucoma care in that collaboration. So there is quite a bit of pediatric glaucoma as well. As I mentioned, it's a fully supervised surgical and clinical training with graduated independence. There's a balance of procedures, and so basically every MIGS that you've ever heard of, we do here and have quite a bit of experience with, as well as standard trabeculectomy. It still continues to be, after all these years, my favored procedure, and I think that every glaucoma fellow should learn how to do a very good trabeculectomy. There's quite a difference between a good trab and a bad trab, and that's where I think a good fellowship will teach you the difference. A balance of procedures as well with our tubes. We do every type of tube. We do the Ahmeds, the barbells, pars plana, infronasals in combination with other complex cases. So we give a very balanced and excellent surgical training here. Again, you have the opportunity to teach and supervise residents, which I think is a place where you learn the most as fellow. We also have weekly management rounds, board review courses, grand rounds, and so on every Wednesday afternoons with superb speakers. Again, as I mentioned, there's a wide range of pathology, so we work in close concert with some of the other services, including the cornea service, where they do a lot of K-pros and PKPs, which of course result in a lot of angle closure glaucoma, steroid-induced glaucoma, and so we do a lot of combination procedures with them, as well as with our retina service with patients who have vitrectomies and so on. So it's a wonderful opportunity to learn those kind of challenging cases. Also, we've been involved in many clinical trials with investigative procedures, and early adoption of the approved procedures. So, for example, the trabectome was introduced in about 2005. I personally have been doing those procedures since 2003, back in the first clinical trials, and one of the first people to do MIGS in the United States. We have a lot of experience with that, as well as with all of the other MIGS that have come to pass since then. And so we're early adopters, and yet we still have quite a respect and reverence for the standard procedures as well. In our fellowship, we provide placement support and ensure that our fellow ends up where they want to be for their lifetime. And so if private practice is what you want to go into, we have great relationships with most of the private practices in the area, and we'll make sure that you end up where you want to be. Okay, I'm going to go through the primary surgical numbers of our fellow from last year, since our current fellow is still wrapping up and the numbers aren't quite complete. But the numbers from last year are really quite representative of the typical numbers that I've been seeing over the past several years. So I'm just going to review those. Typically, we get about 20 plus trabs, and these include standard trabeculectomies and some express shunt as well. Tubes, the last fellow did 64 tubes, and that will include, again, Barvelds, Ahmeds, and the like, especially complex ones, pars plana ones, and so on. 15 cyclophotocoagulation cases, 22 complex tube and trab revisions. I think you learn a lot from trab revisions, and so 22 is quite a healthy number there. 14 MIGS cases, and that does include really any of the MIGS that you've heard about. Pediatric EUAs, 6. The fellow did 179 primary cases and assisted in 372 cases. The surgical exposure for next year, I really do expect an upward trajectory for the current fellow as our volume continues to grow. We actively perform standard trabs. Those are still my favorite, as I mentioned. We do express shunts. We do all the MIGS, all the types of tubes. We participate in several surgical clinical trials, especially with ankle-based surgery. And as I mentioned, we collaborate with the Beckman Laser Institute to do a lot of pediatric cases. A typical work week for the fellow includes surgery with either myself or Dr. Lin, Mondays, all the way till about 1 or 2 in the afternoon. At that point, the fellow goes over to the academic clinic, where they will function as supervising the residents in the academic clinic, but either myself or Dr. Lin will always be in that academic clinic as well, supervising. Tuesdays, the fellow goes to the Long Beach VA, where they work with the residents in the clinic, and then in the afternoon they have surgery at the VA, which again is equipped with all of the equipment that you could hope for. Wednesdays, the fellow is usually with me all day in my clinic, private clinic, and then we have didactics in the afternoons, including grand rounds and journal clubs and so on. Thursday, you'll be with Dr. Ken Lin all day in his clinic, and then Friday back with me in my clinic in Irvine. What about research? There's ample opportunity for research in our program. We contribute and have access to the trabectome database, which goes all the way back for 15 years, and there's basically so much information there, and anything that you might want to look at with regards to MIGS outcomes in certain particular patient populations. We've published extensively with that database. Again, as I mentioned, there's a lot of clinical trial involvement as well. Dr. Lin is involved in machine and deep learning methods, and his research is very productive there. I'm involved in the effects of cannabis and other herbal compounds in glaucoma, and very innovative research is coming out of that. And you can be involved as much or as little as you wish with that. Again, we collaborate with many of the other services, and so a lot of research comes out of those collaborations, and historically has done that. This is, again, a nurturing environment for productivity, and as such, every single fellow I've had since 2004 has presented either at the American Glaucoma Society, ASCRS, or ARVO. Every single fellow since 2004 has published in a peer-reviewed journal during their fellowship. Even though research is not a requirement in my fellowship, it just happens naturally just because there are so many opportunities. And in that positive learning environment, research just happens naturally. Career placement, again, over the last 15 years, 2 of my fellows have gone into academic careers. 3 are at Kaiser, 1 is at the VA system, and 9 are in private practice, many of them in Orange County. So I've placed 1 in Long Beach, 1 in Irvine, in the city of Orange, Huntington Beach, and Fullerton. And what that means is I welcome having my fellows join me in Orange County to provide the best care for our glaucoma patients. This is not a program where we try to maintain, excuse me, a monopoly over the patients. I'm very proud of my fellows, and I feel that putting them out in the community nearby really represents who we are and shows what we have done in our training program. What about the future? What are the changes we expect? We are opening a search for another full-time faculty this summer, and hopefully we will hire someone to start next summer, so the summer of 2021. We are further expanding our surgical and clinical exposures as things develop, of course, and there are always future opportunities for research with Dr. Lin's artificial intelligence and microbubble drug delivery projects. We also have some femtosecond laser projects as it pertains to glaucoma. Dr. Lin and I are involved in a novel imaging device where research is available there. And of course, our MIGS database. So there's really a lot going on. Other considerations when choosing a fellowship program is the environment in which you will be living. You're not only going to be training, but you'll be living as well. And Orange County really speaks for itself. It's a really lovely place to live. It has a wonderful climate, lots of opportunities for extracurricular enjoyment. You know, it really is the pinnacle of human existence. Orange County is tremendous. It's a great place to spend at least 1 year of your life. I do want to reflect a little bit about Gavin Herbert Eye Institute as a whole and not just the glaucoma division, just to give you an idea of what really has been going on here over the past few years. We really are the pioneer in MIGS, even though as a new glaucoma fellow, you'll be hearing so much about MIGS from everyone in the country, but UC Irvine is the pioneer in the MIGS field. Both the trabectome and the iStent were invented and developed at UC Irvine by our faculty. And so we have the most experience with trabecular bypass procedures. The femtosecond laser their applications in ophthalmology were developed here by our faculty, which led to the Intralace and the LensX systems. That's a major development in ophthalmology, and that was developed by our faculty here at UCI. Stem cell therapies, again, were developed and studied for intravitreal injection for retinal pathology, and we have one of the largest stem cell grants to develop that here at UCI. We are leaders in clinical trials, including anti-VEGF treatments, corneal cross-linking, the intraocular telescope trial, again, stem cell research, our surgical techniques, and our novel medical treatments. We have a training program of excellence because of all of these activities. We support the community of respected colleagues, and as a result, we have a tremendous referral system where we get lots of amazing cases referred to us by our respected colleagues. We also have a strong history of collaboration with industry while we are able to maintain our academic integrity and teach in an unbiased way. So in summary, I believe this is a solid training in a nurturing environment with exceptional climate and superb extracurricular options. We have a long track record, over 15 years, of not only training superb fellows, but helping to establish them in their ideal career of choice. So once again, with that, I hope that you consider applying to our program. I look forward to reviewing your application. And once again, congratulations on choosing a superb career choice, and welcome to the world of glaucoma.